7,400 women die a year from ovarian cancer. I went to the GP, tried to get an appointment, got nothing but a phone consult. And I was just told, okay, this could just be menopause. And, you are a woman in your mid-50s and it's possibly IBS. And in that time, I was progressively getting worse in that, there were days that the fatigue was so much that I wasn't going to work. I'm disappointed around the misdiagnosis. I'm disappointed around the medical gaslighting, trying to convince me it's just menopause and nothing else.
Yeah.
But I'm also disappointed in myself because I should know more and I should be more aware of my body. And I'm not. And I'm not the only one because as women, we don't prioritize ourselves. We prioritize work, the rest of the family, the home and everybody else. And we're at the bottom of the list.
Yeah. Welcome to the 51%, the podcast where we cut through the noise and get back to basics when it comes to women's health. Through expert insights and powerful personal stories, we help you tune into what really matters, your body, your well-being, your life. No one-size-fits-all advice, just real conversations to help you understand your health on your terms. But before we dive in, I've got a quick favor to ask. Please hit subscribe and join the 51% community on our website. It's free and helps us grow, reach more women, and create events that really speak to the health and wealth challenges we all face. And finally, just so you know, everything shared is for information only. It's not medical or financial advice, and always speak to a qualified expert for support that's right for you. Okay. Sbba, thank you for joining me today on this podcast. It's fantastic to have you on. We're going to be talking about your journey with ovarian cancer. It's been a very long journey, I know that, and challenging, and there have been lots of issues and things that we will discuss. But firstly, could you introduce yourself and talk a little bit about your journey from what you were doing before to what you're doing now? That'll be great. Thank you so much.
Thanks, Shreya. Thank you so much for having me. It's my absolute pleasure. I'm Sbba Siddique and I am a director at Asian Star Radio, a Bollywood music station that broadcasts all across London that's based in Berkshire. I'm also a really active craftivist and I run a knitting and crochet group that I have been doing coming up to 10 years now where we knit for charity and, we donate items, we raise money. And in the last year alone, we've probably supported over 30 different charities with our projects and campaigns. I'm also a wife, a mother, a daughter, the usual that we women are. And prior to cancer, led a very busy life, a very independent life, a very active life. And in March of 2022, I was diagnosed with ovarian cancer and my world was turned upside down.
Could you talk a bit about how that diagnosis came about? Because I know it was a very long journey with even getting diagnosed and kind of going on from that. How did it kind of transpire that you had it, and what was a kind of impact on that on you and your family as well?
It was a very long road to diagnosis, and I didn't have any very specific symptoms that would stick out and even make me, go to the GP and be insistent about, like breast cancer, where you find a lump and that, really urges you to go and get yourself checked out. My symptoms were very mild. I had symptoms that were just something that when you reach your middle age, you kind of expect. I was putting on weight. I needed to go to the toilet a lot more. I was bloating. I was eating, but I was getting a little bit full. And so, I was generally unwell. And so in sort of like probably around the August, September of 2022, I started to think, okay, I need to do something about this. I went to the GP, tried to get an appointment, got nothing but a phone consult. And, I was just told, okay, this could just be menopause and, you are a woman in your mid-50s and it's possibly IBS. And this was what went on for the next 6 months.
Wow.
And in that time, I was progressively getting worse in that, there were days that the fatigue was so much that I wasn't going to work. The bloating by Christmas time, it looked like I was 6 months pregnant. And yet my GP was insistent that it is just menopause and I need a better diet and I need a better exercise regime. And it could just be IBS. I then just had a routine appointment in the January of 23 with my dermatologist. And at the end of the consultation, she looked at me and she said, Sbba, have you had your stomach checked out? And I said, oh, yeah, I have been seeing the GP and they're just saying it's menopause. She goes, no, go and get yourself an in-person appointment. Because bear in mind, up until now, it had all been either e-consults or a telephone consultation. And that triggered something in me. Up until those 6 months, we as South Asians, we believe what the doctor says. Actually, most people believe what the doctor says because they're the experts. And for those 6 months, I believed them because I didn't know any better, because I wasn't aware of, ovarian cancer or the diagnosis or the symptoms and what I needed to look out for. So when she kind of said to me, you go and get it checked out, that rang alarm bells in my head that, hold on, actually, maybe I'm not wrong. There is something here and I do need to go and get it checked out. That was on a Friday. Monday morning, I was on the phone to the doctor and I was insistent. And I was a drama queen. I said, no, I want to see someone. So I managed to get an appointment. And he said, okay, right, well, we'll do, I'm still confident it's nothing, but, well, let's do a broad range of blood tests. Did the blood test and the cancer markers, the CA125, came back raised. And even at this point, I still did not think it was cancer. Even at this point, I just thought, okay, I was perimenopausal and it could just be coming to the end of my periods. It could be endometrius related, anything like that. Cancer never crossed my mind. Based on that, they recommended having an internal ultrasound and an external ultrasound. And that came back with, they found some growths. So I had then had a CT scan and an MRI scan and was booked in to see the consultant within 10 days. So I had 6 months of the very worst of the NHS. And then within 10 days, when those cancer markers came back raised, they were amazing. I had every test possible and I was seen by a consultant. My diagnosis was delivered to me within about 3 minutes. I walked into the room, I sat down, the consultant was there, there was a nurse there. And when they had written to me, they said, bring someone with you. So I took my husband, but still didn't think that, well, why are they asking me to bring someone with you?
Yeah.
We sat down and the doctor said, oh, do you know why you're here? And before I'd even had a chance to reply, she said, so your scan results are back and we suspect ovarian cancer. And I looked at her. And I'm looking at her face. She's talking. Her mouth is moving, but there's no words. All I hear is humming. It's not registering. And then she handed me a pile of books and said, okay, so this is your CNS. She's going to take you into the next room and she'll explain further. And I walked out in confusion.
Yeah.
It hadn't registered. What is she saying? And that was all of 2-3 minutes that it took for her to deliver this devastating news. And it was just so matter-of-factly and well, I've given you books now, go with the nurse and, I've got my next patient to see.
Yeah.
So sat in the room next door. My nurse was absolutely brilliant, so compassionate, so caring. She was calm. She was very open to explaining every question that I had, although I didn't have many because my head was just still not comprehending what had been said to me. And we left there, my husband and I left there, and we just went and sat in the car. And he was about to drop off, and I said, no, just wait. So we sat in the car for about 10, 15 minutes, silence, nothing. And then I just said, what am I going to tell the kids? And I just cried. I cried. He cried. We cried some more. And it still hadn't sunk in. And my first thought, what am I going to tell my kids? Now, bear in mind, my kids are adults. They're not tiny tots. They're not children. They're all grown adults. But that doesn't matter. As a mother, that's kind of like your first instinct. And we went home and the kids were there and we kind of sat and had a conversation. And I don't know what made me do it, but the minute I got home and I saw them, I made this conscious decision for myself that whatever this is, wherever this goes, these guys are going to be involved in every step of the way. Don't know what made me do it, but that became so important further on down the line.
Yeah.
And that was my diagnosis.
Well, do you feel like if you had been seen by the GP in person initially from the beginning, it wouldn't have got as further as it had got, you know?
Yes, 100%. But also...
What stage did they...
I was diagnosed at stage 3C, so quite late. But that's the case. Ovarian cancer is a disease that doesn't have any overt symptoms. So, you know, the swelling, the bloating, the needing to go wee a lot, that mimics a lot of other things that it could possibly be, especially if you are going through menopause. And you have to, I mean, remember that 7,400 women die a year from ovarian cancer. 70% are diagnosed via either A&E and at a stage 3 or 4. So the gap there is, yes, I'm disappointed around the misdiagnosis. I'm disappointed around the medical gaslighting, trying to convince me it's just menopause and nothing else.
Yeah.
But I'm also disappointed in myself because I should know more. And I should be more aware of my body. And I'm not. And I'm not the only one. There's many women there that aren't as up to speed in, you know, their own physical and mental health. Because as women, we don't prioritize ourselves. We prioritize work, the rest of the family, the home, and everybody else. And we're at the bottom of the list.
Yeah. Yeah. And you mentioned that obviously they assumed it was menopause. Yeah. Were you perimenopausal at that stage or post?
I was peri.
You were peri?
Yeah.
Now, from what I understand is, I know that sometimes symptoms can be one or the other, but in order to either diagnose whether you are perimenopausal or it's something else, you have to go through a series of tests to rule things out. So it's almost as if that absolutely wasn't done.
Yeah, that was absent. You know? That was absent. And that for me, it was only when after me kind of like stomping my feet a little, that I got the broad spectrum blood tests done and the markers came back raised, that then triggered, okay, the cancer pathway.
Yeah.
So it's really frustrating, but I think, the NHS isn't designed for people of colour. It's not designed for people like me in mind. And that really does need to change. But then I think we ourselves as individuals need to be taking far more responsibility for our own health. But at the same time, there needs to be more cancer awareness campaigns too.
Yeah. I mean, the problem is also with the South Asian community, none of this stuff is talked about.
Absolutely.
And so it's that added layer of, you know, you just kind of, you know, typically South Asian women prioritize themselves the least.
Yeah.
And, you know, someone kind of, we're both similar age group. It's almost kind of, you're brought up very differently. You know, we bring our children up differently now.
Yeah.
And hopefully they're more educated and, you know, because we speak about it.
Yeah.
But growing up, we didn't speak about anything. My mum didn't tell me anything.
Yeah.
You know, about checking breasts, periods,
yeah, absolutely.
you know, what a period was. And granted, maybe she didn't know herself. She probably didn't. But periods she would definitely know about because she would have had one.
Yeah.
But there was no conversation. I only knew what a period really was when I actually had mine. And that was kind of all hush hush and, oh my God, you know, what's going on? I thought I'd cut myself or something had happened.
Yeah.
And it was almost like, here you go, quickly put this pad on and that's it now. This is you for the until
next 30 years.
Exactly. I wasn't even told that, you know, I had no idea about menopause, nothing. So I know you do a lot of campaigning, you know, especially educating South Asian communities. Can you talk a bit about that and also why you think that's important and what was your experience with the taboos as well?
Okay, that's a lot to unpack. I'm going to start with kind of like, why do I advocate? And that goes back to a period during my journey where there was trauma. So I navigated 2 surgeries, immunotherapy, IV chemo and oral chemo. And there were points when I would go for chemo that I felt and I was treated differently when I was wearing my South Asian clothes.
Right.
So when I was wearing joggers, trainers or whatever, it was very different. And when I was wearing like a shalwar kameez or a kurta, it was very, very different. And that was also at the hands of other South Asians. And that confused me. I can understand discrimination because of unconscious bias from people that are not South Asian. But to have it by my own community or people from ethnic minorities was just like, hey, what the hell is this? And then it came to me, sort of like this was post my NED and getting the all clear, that it's because of the system that they are trained in. That this is, as I said, the NHS is not designed for people of colour, but also there is bystander syndrome. You don't want to be the one that's speaking out in front of your colleagues because you don't then want to be circled out, right? So there was all of that. So there were health inequalities. Sadly, my first surgery failed. That left me with a lot of trauma. I had 48 stitches, chest to pelvis, but nothing to show for it. It was major surgery because I was having absolutely everything out, you know, the womb, the cervix, the ovaries, the uterus, the lot, all of it. And the mental health challenges I faced post that were hard, very hard to work through. I then had to try the chemo in order to shrink the tumours for the surgeons to be willing to operate again. Chemo itself, it takes the life out of you. The side effects are debilitating. The impact on your life, you know, people just look at it as, oh, you're going to lose your hair. No, it runs far, far deeper than that. And, you know, I could list so many things: constipation, diarrhea, nausea, sickness, vomiting, you name it. I can go on and on and on. And each of those side effects is very, very different. If you are from you know, they're different depending on your DNA. Yeah. And as South Asians, we are different, right? Yeah. Those treatments are all designed with Caucasians in mind. I then went on to oral chemo, and this was the darkest point throughout all of my journey. One of the side effects, apart from all the usual suspects of the nausea, the diarrhea, the sickness, the hair loss, and all of that, is there was a potential of getting a skin rash. Now, I thought to my skin rash, bit red, bit dry skin, I can cope with it. One of the things that I did very early on through my journey was I refused to go down that Google rabbit hole and speak to Dr. Google, because that is a frightening place to be. Yeah. So I would only use reputable websites. It was the NHS, the NICE website, and the Macmillan website, and also ovarian cancer charities websites, so that I was getting authentic information. And I looked for this medication, this side effect, what's it going to look like on South Asian skin? Found zero. Not one picture, not any bit of information, nothing. I still went ahead with it because my choices were very limited. Surgery had failed. My IV chemo wasn't successful. That's why I then moved on to the oral chemo. Took the tablets, first couple of weeks, absolutely fine. By about week 3, I started to get spots on my face, and very much like acne, much like teenage spots. And that progressively got worse. And by about week 5 and 6, I was covered in a rash from head to toe. That rash I would not wish that on my worst enemy. In the space of about 7 weeks, I was hospitalized 4 times due to it. The rash was from head to toe, and my skin was just peeling. When I went into hospital, doctors described it as what they see in acid burn victims. And what would happen is that internally I was freezing because my body was drawing heat from internal organs to try and repair the skin, but the skin was burning. And I would shiver and I would shake. This would go on for like 4 or 5 hours. And it would literally be until I passed out from exhaustion because my body just couldn't take it anymore. And that period of time, those last 3 weeks that I was on that medication, were the darkest. I was in complete abject darkness physically because it had bashed me. I wouldn't be able to get up and go to the bathroom by myself. The fatigue was that much. There were points I wouldn't even make it to the bathroom.
Yeah.
And as somebody who had been so independent, having to watch your children clear up after you, watching your husband clear up after you was heartbreaking.
Yeah.
There were days when they'd say to me, Mum, are you okay? And I would say, yeah, I'm fine. I'm having a really good day, because I couldn't see the pain in their eyes anymore. I reached a stage by the end of 7 weeks where I wanted the pain to end. I wanted treatment to end, and I wanted actually life to end, because I was physically and mentally absolutely broken. But so I came off it because I couldn't do any more. I came off it, but thankfully it had done enough for the surgeon to say, right, yeah, we will operate again.
Yeah.
But there was then that recovery from this. The rash took quite a while to recover from, and the rash, as I said, was all over my body. I went to see my surgeon 2 weeks before my surgery date, and the rash was across my belly as well. And at that point, she said to me that actually I may not be able to operate. And that was heartbreaking because of the rash and the risk of infection. So now, when I was already suffering from psoriasis, so I was on the NHS waiting list for a dermatology appointment. This has all now come in the middle of all of it. My GP has been chasing it. My oncologist has chased it. And now my surgeon is going to be chasing it. I had a window of 10 days with the hope that that appointment would come, because if it didn't, then she wasn't operating because the risk of infection was too high. I had to end up going privately. I had to go and see somebody privately so I could get some creams, I could get some medication to be able to have that area at the very least clear in order for surgery to happen. And I did, and surgery took place. And in March of 2023, I had surgery and it was successful. I'm 100% tumor free with no residual disease, and now 2.5 years in remission. That is what spurred me to the advocacy work.
Yeah.
The lack of information on treatments for people from South Asian communities, or even just minority BAME communities. The lack of awareness that how do we prevent these diseases from happening in the first place? How do we become effective self-advocates where we are able to advocate for ourselves with the correct information? That's what drives me. That period of my life was the darkest, as I've said before, darkest throughout my life, right? It was painful. It took me to places I would wish not even on my worst enemy to have to go, physically, but also mentally. I didn't want that to not mean anything. What I'd gone through had to have value, had to mean something, had to have purpose. Yeah. So I took that pain and I turned it into purpose, and this is my purpose. It's advocating for better, for health, battling against health inequalities. It is encouraging women. Knowledge is power, right? We need to be able to self-advocate, and you're not going to do that without education. Yeah. So it's encouraging more education. It's encouraging women to be able to self-advocate. But it is also about looking in the mirror and facing my own community and telling them to do better. Because this is not a one-way street. You know, as people of colour, the health inequalities we face in a system that's not designed for us is there, doesn't matter. But we've got to accept some of the responsibility as well. Yeah, absolutely. And we've got to take that on our shoulders, and we have to do better too. Sadly, I faced a lot of backlash from the community, predominantly men, because I was talking about my journey. I remember one distinctly, somebody, an uncle in the family, as they do, ring me up and say, why have you put those photographs up on Facebook? And I'm racking my brains. What photographs have I recently put? And literally he was talking about 2 photographs that I had put. One was of me pre-cancer, and one was me with my head when I had it shaved because of the hair loss. Yeah. That apparently is shameful. I shouldn't be putting that picture up. The other thing that I found is that because I was talking about gynae cancers, people were very closed to having those discussions, even women. That needs to change. Unless we have open and frank conversations around these things, things are not going to change. Those outcomes are not going to change for women. We are going to, women are losing their lives because we are not having these conversations.
Yeah.
And it is as simple as go for your mammogram when that breast screening, letter arrives. Self-check, examine yourself, go and educate yourself, attend events, listen to podcasts like this. It is all about being able to do better for yourself.
Yeah. I think this podcast with you is it's not just for women who have been through the journey or is starting their journey. It's for people, to everyone, women, men, whoever, to understand the symptoms and what actually, even if it just helps one person and think, actually, I'm having certain symptoms, I need to make sure my appointment is one-to-one, in person, push for that blood test, push to get referred, rather than, they should be learning from your story,
Absolutely.
Because at any point in their time, you could get diagnosed. This is not something that happens definitely in your 50s. It could happen in your 60s or much older. Yeah. So if you're kind of, got all that information earlier, at least, later on in life, it might be able to help you as well.
Yeah. I talked earlier on about how I made the conscious decision to have my family involved in my care every step of the way. And the reason for that was that dark period where I was just so bashed. I didn't have the physical or the mental ability to actually advocate for myself. But because I had had these open and frank conversations with them, my husband and my son included, they were able to advocate for me. Because they knew what my wishes were. They knew what I had wanted. They knew what I wanted in my treatment moving forward. And if I hadn't had those conversations, then maybe, I wouldn't have been heard. I wouldn't have been listened to because I wouldn't have been able to advocate for myself. And it's essential in these conversations around women's health. Male allyship is essential.
Yeah.
Because at the end of the day, it's like, 49%, right?
Yeah.
They make up they're our other half. They're our, counterparts, and we need their support in amplifying women's voices and women's issues. We can't do this alone. We can't stand alone. And even within my advocacy work, I don't do it standing alone in my silo. I collaborate and I connect. I work with some leading charities. I do a lot of work with Target Ovarian Cancer. I do a lot of work with Overcome. I do a lot of work with Macmillan Cancer Support, because the more people that we are reaching out to and shouting together with, the more we are going to be heard.
Yeah, absolutely. Was there any point in time with, after you were diagnosed, did you ever go back to your GP and say, you misdiagnosed me? Or in the sense that you didn't see me sooner and it could have been caught sooner?
If I'm honest, no. And for me, the campaigning and advocacy work that I do, that is actually picking up on that.
Yeah.
A lot of the work that I do with the NHS, because I now am a patient voice for NHS England's National Cancer Programme, which is feeding into the new National Cancer Policy. I also work very closely with my local Cancer Alliance, and this all feeds back to primary care on, where things can be better. There is no point me going back to my GP and just having a conversation, because that's just one GP. I want this as something that is nationally recognized, where we address the systemic inequalities, and we are working with the system to bring about those changes. I've taken the fight globally as well, because I am now a part of the strategic advisory panel for the World Ovarian Cancer Coalition. And it is really important, because what feeds into the work that we do here in the UK is mirrored around the world. And the same problems exist wherever you go. that lack of awareness, that lack of education from primary care, as in GPs. So we are facing the same challenges. I think here in the UK, GP education is vital. And it's everybody within a GP surgery, whether that's the receptionist, the nurses, the doctors, you know, whoever you have, the pharmacists within there. There needs to be more awareness around the signs and symptoms of ovarian cancer because of how closely it does mirror other diseases.
I just had a thought, you know, we're talking about South Asian communities and the lack of research on us. And, you know, like you said, you broke out in a rash. There was nothing. You went to the kind of, you know, things like the NHS and the NICE guidelines. There was nothing on there to suggest, you know, there could be certain different types of reactions for South Asian communities. Do you think, you know, you may or may not know this, I don't know, but going back home, like from our roots, you know, like if you try to look for research in Pakistan or in India, or in other South Asian communities, you know, in those countries, do you think there would be some research on certain drugs that are used or the reactions of South Asian women and these kinds of things? Because that's just a thought that just literally popped up in my head. I thought, we don't have the research here, but in our kind of home countries, maybe there is something there.
Yeah, I mean, I'm sure there is work going on there, but I think it's vital for us that as we are here and we are going to go through a system that treats us here, we need to be, and our lifestyles are very, very different here, and that does also impact on you know, what illnesses you may possibly end up getting. There is a huge gap in data and research for BAME communities and historically marginalized communities, but that there is a shift happening there. Moving forward, I think it is really important to get people from these communities involved in research. I mean, I'll give you a prime example. When I was first diagnosed, they ask you that question. Oh, do you have any history of cancer in the family? I said no. Not because I definitively knew, but because we don't talk about it. And when I got diagnosed, 2.5 years later, when I got my NED, you know, there were people popping up the woodwork. Oh, you know, my Daya's daughter had this and my uncle had that. And well, where was this information when I needed it? Because the problem there is that when you answer no at that point, that shuts down the conversation on genetic testing and hereditary risk. So it is so important having these conversations and normalizing these conversations because we need to do better for future generations. Statistics are absolutely frightening. 1 in 2 of us is going to receive a cancer diagnosis. A few years back, you know, it was 1 in 3, but here we are, we're at 1 in 2.
And it was even more before that.
Exactly.
You know?
Wider. And so now, if it's not you, it's going to be someone you love. So we need to be able to do far better for those that are inevitably going to follow.
Yeah, absolutely. It's scary, actually. I've been thinking regarding the statistics. It's absolutely scary. Like, you feel like there's so much research and money being pumped in to, you know, Macmillan and, you know, through research, through, you know, Imperial, whoever's doing the research. But we're at 1 and 2 now. It baffles me. It really baffles me. And I know, you know, our diets have changed, the environment's changed, lots of things have changed. So if it is a case of 1 in 2 now, we need to do better.
Absolutely.
We really do. We need to do better and talk about it and find out what's going on with our bodies and just relay the information on to as many people as we can.
Yeah, and the other thing with ovarian cancer that is so important, there is no viable screening tool. So like you've got, you know, for cervical cancer, you've got the smear test, you can, and, you know, or for breast cancer, you've got like the mammogram. But for ovarian cancer, there is no viable screening program currently. I'm part of the patient voice for a fantastic project that's being led by a chap called Professor Ahmed out of Oxford University, who are developing a vaccine against ovarian cancer as a preventative tool. There is some groundbreaking work going on there. And when that comes into fruition, it is going to be an absolute game changer. The thing that Professor Ahmed has done is that he has included the patient voice in his research right from the beginning. He's also got funding from Cancer Research UK to develop the project further. So there are subtle changes happening in the research and data landscape. There are lots of different organizations that are, making the data sets wider. So they do include patients from minority communities so that better treatments can be. But it's a slow process and it will take time. But that shift is definitely happening.
Yeah, there is definitely research coming through. And, but my motto is you can't wait for the research to catch up. It's like you'll be waiting for God knows how long. So educate yourself, advocate for yourself, speak to as many people as you can to share experiences, whatever that might be. Yeah. Because there are people out there like yourself, that there are. And the more people form these communities and start understanding and learning, perhaps diagnosis would, you'd get diagnosed a lot quicker and you'd get treated a lot quicker and, you might live longer.
Absolutely. Or, at the very least, you will be diagnosed earlier, which means, there'll be less invasive treatments. Yeah. And that treatment journey will be a lot easier. I mean, I do a lot of speaking engagements at women's health events, conferences. And one of the things that saddens me is I've had a few women come up to me and say, thank you. And I should be really happy about that, right? Thank you for sharing your journey. It's great. No, because the next sentence is, you've given me permission to talk about these things because, we don't do that at home. That's how deep-rooted the stigmas and taboos are, and that is what needs to change within our community. These conversations need to be normalized. Yeah. It's sad that we're in 2025 and the female form is still first and foremost looked at in a sexual way, not in a medical way. Yeah. And that is what needs to change. And also language. It's really difficult sometimes to communicate between generations because the language doesn't exist. There isn't a word for breast in the Urdu language or the Punjabi language. No. There's a word for chest, but not breast. And it's these simple nuances that make that challenge even harder. So we need to be having open and frank conversations so that we are normalizing them for the future generations. I mean, I remember growing up and like you said, you couldn't even say the word period in front of your dad or your brother. It was like, shh, hush, hush.
Yeah, it's terrible, really terrible. I remember there were so many kind of taboos around it. I couldn't even tell my mum half the time, and if I was, I was lucky, I didn't have like severe pain and all of these things, but I just couldn't talk about it.
But even then, Shreya, when you had pain, what did you do? You popped a couple of tablets and you got on with it. Yeah. Whereas now there is so much information out there that a period is not meant to be painful.
No.
And, but we just shut up and got on with it.
Yeah. I never knew that until recently.
Same.
Now I tell my girls, if at any time you're experiencing this, and this, it's not normal. And don't accept it to be normal. And don't fill yourself up with Nurofen and ibuprofen and paracetamol because you're just masking the problem. You need to be investigated to find out what's actually going on. And I can't stress that enough for anyone, for anything, And also the other thing I want to say is, if you are going through perimenopause or you think you are, or you're experiencing, the 30 plus symptoms of perimenopause, look it up because there's not just 10, there's so many, like literally there's so many. Don't put it down to just perimenopause because it could be something else. That is, that is another thing I've learned as well, because I used to always be, it's probably perimenopause. Yeah. It's probably perimenopause. But you need to get it checked out.
Why is that? Because as women, our society conditions us to dismiss our pain. Because if we're in pain, we're not doing all the things that we should be doing. We're not taking care of the house than everybody else like we should be. And you said a word earlier on, normal. Yeah. That is the perfect word. We all individually as women need to know what our normal is. Yeah. We need to know what that baseline is. And if something goes above that baseline, then don't dismiss it. Go and get it checked out. It might be nothing, and great if it is nothing.
Yeah.
But if it is, then you are empowered to be able to make educated and informed decisions about what you want to do moving forward with that.
Yeah, absolutely. I want to kind of just touch upon, you mentioned, mental health.
Yeah.
And that's another taboo thing in the South Asian community and, Black, Asian, South Asian communities. How did you deal with that? Because obviously it's a taboo subject. Yeah. I know you were very open with your family, your immediate family, but were you able to express yourself generally with your mental health struggles, and how were you treated when you had mental health struggles by the NHS, in the sense that did they help you?
Okay, so I struggled with my mental health first and foremost.
Yeah.
I was just ignoring it. I was ignoring what was going on because mental health doesn't really exist in South Asian communities, right? You just shut up.
Of course it doesn't.
No, you just shut up and get on with it.
Yeah.
And it's a sign of weakness, and it's a sign of, they use the word tupagale, right?
Oh, yeah.
That you're just crazy. And I didn't want that label. I didn't want to be perceived as somebody that can't cope, especially because I was so independent before, running my own business with my husband, having a very full and active life, very full and active social life. And all of a sudden, I can't have mental health issues. That's just not me. So I struggled with acknowledging it myself. But when I reached that stage where I wanted everything to stop, even at that point, it was like, okay, I need to speak to someone. I need some help. And I didn't want to speak to my immediate family, not because I don't love them, not because I don't trust them, not because, they're going to judge me or whatever. It was none of those things. It was because I felt like I had burdened them enough with how much they were looking after me physically.
Yeah.
I now did not want to burden them anymore, especially with how dark some of the thoughts I was having were.
Yeah.
I would look at them, look at me with such pain in their eyes already. That broke my heart. I couldn't burden them anymore. And then I spoke to my CNS and she suggested counselling. So I had counselling and I had it via Macmillan. And I was very skeptical, if I'm very honest, because she sent me through the details. She said, "Oh, his name's William. He's lovely, and it's gonna be great. It's really gonna help you." And that unconscious bias that kicked in for me. Okay, William, he's gonna be white.
Yeah,
he's not a woman. He's probably middle-aged. How the hell's he gonna know what?
Can't relate to your culture and what
Yeah.
There's lots of things.
What's going on here?
I can imagine. Yeah.
And I was very hesitant that okay, do I do this? Do I don't do this? And I thought, you know what? I've got nothing to lose. Best decision ever. Because it wasn't about, at that point for me, yes, my cultural nuances came into a lot of the conversations later on down the line. But in the initial stages, that didn't matter. Because for me, what was more important is just having someone to talk to that's non-judgmental.
Yeah.
That wasn't going to question anything that I say, wasn't going to give me unsolicited advice. It was just a place for me to unburden myself of all this pent up emotion that I had nowhere else to put. So as somebody who has gone through something so traumatic, I fully recommend the benefits of counselling. Go and get it. If you can, I know there are long wait times. If you can afford to do it yourselves privately, go and do it. It is one of the best decisions that I made. And the reason I benefited so much was because the problem I identified I was having was there were lots of different thoughts and there were lots of different things going on in my head, but it was like a whirlwind. It was just going round and round and round, and I wasn't able to make sense of a lot of things. Counselling gave me the ability to separate things and then compartmentalize things, and then to be able to deal with those things and challenges in bite-sized, easily digestible chunks in a way that I wanted to.
Yeah.
And yeah, like I said, best decision ever.
How did your family or, people outside of your immediate family, your husband and your children react? Was there any kind of added layer of taboos and kind of negativity around that?
Yeah, I mean, there was and there wasn't. I mean, there was, I kind of like class it as, it was God's way of removing certain things from my life. I lost a few friends along the way, but at the very same time, other people that had been on my periphery actually stepped up and filled that gap in a far more wholesome way than I could have ever anticipated.
Yeah.
And it was, for those that fell away, I don't blame them because cancer is a very difficult conversation, and some people find it very difficult because they've either experienced it themselves or through a loved one, understand how to deal with it, and they don't know how to treat you either. So it is what it is. And the way I looked at it was that I suddenly had this, group of women that just totally stepped up into this space just to support me and be there for me in the way that I needed. And that was kind of like God sent, because it was not something that I had to ask of friends. They would just do.
Yeah.
And with regards to I've got 3 sisters. They were like second mums. Yeah. They'd built up this little rota amongst themselves where they would ring me, they would call me, they would come around and see me, they'd bring me care packages. But it was very much no pressure. So, and they didn't take offense, because there were days where I was so battered, I didn't want to see anyone, speak to anyone. And so they'd just video call me. And, or, they would never show up unexpected. It was always at my pace. And I loved that. And then there is this one friend, and I always tell this story. There was this one friend. She's absolutely the most beautiful soul ever. She would ring me every Friday because she would sneak a little bit of time out of her work. She works from home, and she'd ring me around brunch time, and we'd have a chat. She lost her mum through cancer. So she totally gets it. And she'd ring me up and we'd have a chat, but it would never be about cancer. It would never be about how was treatment, how was this, how was that. It would be about the weather. It would be about her office gossip. It would be about what her mussy did, or or it would be about what her dyer did.
Yeah.
And it was like harmless, just absolute nothing conversation. But that for me was so heartwarming, because for that half an hour, I didn't have to think about treatment. I didn't have to think about chemo. I didn't have to think about cancer.
That's true, actually, because that's constantly on your mind.
Radar.
It's there always. And to just have that conversation that's completely different, there's no talk of it, it's just refreshing.
Yeah,
right?
absolutely.
Yeah. No, I often wonder, the way people react. And you're right, it is an opportunity, actually. There's a positive and negative.
Yeah.
You kind of find your tribe, you find the people that are meant to be there. And that just kind of carries on, which is beautiful, really.
It is. And do you know what I liked about it was that nothing was forced. It was all organic. It was just so wholesome.
Yeah, absolutely. So everything you've been through, okay, I want to ask one question. What advice would you give to women that potentially could go through something, might be going through something, know someone that's going through something? What would you have done differently, knowing everything you know now?
I think the most important thing is, and I said it earlier on, knowledge is power. I would have made sure that I was more informed about women's health, being perimenopausal, about the menopause, because you don't, there is no education around that.
No.
And even going through life, it's kind of like what you pick up when you get symptoms, you'll go and do a bit of research on it or whatever. So that education is so important. Educate yourself, go to health events, attend them, go and hear people speak, get yourself literature, just, be more aware of what you as a woman are going to go through. And we go through a hell of a lot, right through from puberty to childbirth. And then, you know, the wonderful gift of menopause at the end of it. So it's all coming from the minute that you start those periods. All of that's ahead of you.
Yeah.
This is one of the things that I would really love to see is more education around women's health in schools.
Oh, yeah, absolutely.
You know, PHSE classes, just that they take into account that all of the steps that a woman goes through in her life, that even if there is basic level education, that's a good start. Know your normal, you know your body the best, and have that benchmark of what your normal is of, you know, everything, whether that's your periods or whether that's, you know, checking your boobs, you know what normal looks like, so that when something isn't quite right, you're able to identify and pick up on it a lot quicker. But more importantly, if and when you do pick something up, go and get it checked out. Don't dismiss yourself. Don't put yourself at the bottom of the list and say, oh, I'll do it next week. I'll do it next week. No, go and do it. Go and get yourself checked out. At the end of the day, the impact of any illness isn't just the patient. Because like for me, the impact was on my husband. It was on my children. There is that ripple effect in the family. Women tend to be the heart of the family that kind of like glue it together, keep it together, keep it in order, keep everything running smoothly. So, you know, you're not doing yourself any favors by not getting yourself checked out. Because if suddenly you're down, man down, that's it.
Yeah.
There are other things that are going to ripple and fall apart. So you need to be at your best, first and foremost for yourself, but also for your loved ones.
Yeah.
Those for me are the kind of like the two biggest things is just educate yourself, know you're normal, and do something about it.
Yeah. I always say, you know, preventative, you know, be preventative. Don't go to a health event or some kind of, you know, find out about some kind of health issue when you've got it.
Yeah.
You know, find out about your body and different aspects of women's health and women's physiology beforehand, so that you are prepared.
Absolutely.
For anything.
Yeah, and that's the exact place that I was. I've got no history of cancer in the family until, you know, after my diagnosis when I found out.
Yeah.
And I had zero knowledge on ovarian cancer. I knew about breast cancer. I knew about cervical cancer. And hey, I actually thought I was being so good because I would go for my smear every single year. I would go and have my, and then there was the assumption that, oh, well, it's going to pick up anything gynae. And that rocked my world when I found out that it didn't. And it doesn't pick up for any other cancer apart from cervical cancer. And you know, I'm not alone. I asked that question to like 10 girlfriends and they said, oh, there was only 2 of them that knew it didn't. So there is so much education required out there. And I had no idea that, you know, that what ovarian cancer was, what its signs were, what its symptoms were. So that education is so important.
Yeah. I think, honestly, the key things here are education, know your body, and always advocate for yourself, and, you know, tell your family, tell your husband or your partner or your brother or your sister or your daughter, son, whatever. Talk about these things in the house. Talk about when you're on your period. Talk about if you're going through menopause. Just talk about it so that it becomes a normal conversation in the house. And perhaps someone else might pick up on something and say, you know, look, mum, or your husband or wife, whatever, sister, you don't seem right today. You seem like a bit like you're dermatologist?
Yeah.
She said, you need to go and see someone like right now, like, you know, urgently.
Yeah, absolutely.
You know, you need to have that for sure. Sbba, thank you so much for being on the podcast. It's been fantastic to have you on, and thank you so much for sharing your journey. I really appreciate you doing that.
No, thanks, Shreya. Thank you for having me. It's been absolutely brilliant. And I wish you well with the 51%.
Thank you.